Your AMCAS Activities Section can actually make or break your application to med school. It's more than just listing out what you've done. It's actually your chance to showcase your character, your dedication, and your readiness to become a physician. It's one place where you can actually weave your narrative through your application. So today I'm going to walk you through step by step how to build a powerful activities section that can actually grab the attention of the admission committees and boost your chance of acceptance. First, let's look at just understanding the section as a whole. The application, it does allow you to list up to 15 experiences, and each of them are categorized: clinical, research, volunteer. You also get to choose 3 most meaningful entries with additional space to be able to highlight why these experiences impacted your journey specifically towards medicine. Admission committees, they don't just look at quantity, they really do deeply assess the quality and the authenticity of your activities. So you want to choose them wisely. Whenever you select the 15, you want to make sure that you prioritize the activities that are going to demonstrate your clinical exposure. So direct patient interaction really is critical. You want to highlight what you learned, what your role was, and how it influenced your decision to actually become a physician. Also, community service. You want genuine, sustained commitment to serving others to be able to show compassion and dedication. And you want research experience. You want to be able to showcase your critical thinking, your collaboration, and your perseverance through either lab or clinical research. You want to be able to show leadership roles. Admission committees really love students who have taken initiative and responsibility. And you want to include any unique hobbies or interests. So these are going to help to add personality and help you stand out as a person among thousands of applicants. Remember, it's about impact, consistency, and growth. You're not just checking boxes with these. You also need to be able to write impactful activity descriptions. It does matter how you describe these activities. Each activity description is limited to 700 characters. So your goal is concise storytelling. Follow this structure, and that way you'll have a lot of clarity and impact. Role and responsibilities. Briefly describe your role. Impact. Clearly state how you contributed meaningful or made a difference. Reflection and growth. Explain what skills or insights you gained and how this shapes your future as a physician. Here's a really effective example of a great description. Volunteered weekly at local hospice, providing companionship and emotional support to patients. Witnessing patients' resilience inspired a deeper commitment to compassionate patient care and reinforced my determination to become a physician who prioritizes empathy and dignity at all stages of life. Each word counts. Make sure that you keep it clear, compelling, and of course, most of all, be authentic. Let's talk about the most meaningful entries, those top 3. The most meaningful entries get an extra 1325 characters each, so it gives you a lot more space to be able to deeply reflect. Use this as an opportunity to illustrate significant personal growth, challenges that were overcome, or profound insights. Set the context briefly, why this experience stood out among the others. Describe specific moments or stories to illustrate impact. Reflect deeply on how this experience really influenced your personal and professional journey towards medicine. An excellent, most meaningful entry is going to clearly demonstrate transformation and maturity in your experiences. So let's talk about some common mistakes to avoid. You really want to avoid these pitfalls in listing out your activities. Do not list duties without reflection or insights. Do not exaggerate or inflate your experiences. Be honest and be authentic. Don't include activities just to fill the space without actually having genuine significance. Don't use poor grammar. Don't have careless errors. Always proofread. Admissions committees spot these mistakes very easily, so take the time to really be thoughtful and be thorough. All right, some final tips about strategies, submission strategies. Before submitting, make sure that you go through the activity and ask yourself, do these activities show a clear, genuine commitment to medicine? Have I demonstrated growth and maturity? Does each entry clearly highlight unique traits or insights that really make me stand out? Have your activities reviewed by somebody that you trust, a mentor, or an advisor who's familiar with the med school admissions process to make sure that they can really verify the clarity and the impact. If you want personal support, personalized support in crafting your best possible application, we do offer dedicated strategy sessions to really make sure that you can design your maximum chance of acceptance. If that's something you're interested in, click the link in the description so that we can talk about that. And as always, don't forget to subscribe. We are here every week with new insights to be able to guide you through successfully getting past your MCAT exam and getting your application accepted into medical school. Thanks for watching and best of luck with your application.